Good afternoon, folks. Now, I made a little presentation about a narrative about America can no longer treat long-term care as a private family problem. We must enact a national financing network or framework, paid family leave, workforce investment, and targeted supports for low wealth communities now. Okay, so that's what we're discussing for C. So let's get going. Sit back and enjoy, please. America can no longer treat long-term care as a private family problem. We must enact national financing framework, paid family leave, workforce investment, and targeted supports for low wealth communities now. Key considerations for policymakers: cost containment versus coverage, federal state roles, workforce supply, equity for marginalized communities, and sustainable financing. These trade-offs should shape any legislative package. A more policy-forward narrative: opt-ed caregiving costs. The caregiving crisis is not creeping toward us. It is already here, reshaping the financial stability of millions of Americans, families, quietly destabilizing the broader economy every week. Health system leaders see the same pattern: a family pushed to the brink, not by a catastrophic illness, but by the ordinary, predictable needs of aging. The problem is not personal failure, it is policy failure. The structural flaw at the center of American aging. Long-term care in the United States is financed like a luxury good rather than a universal need. Families are expected to pay out of pocket until they are nearly impoverished, at which point Medicaid steps in, a design that punishes middle income households and accelerates intergenerational wealth loss. Medicare's exclusion of custodial care is the single largest driver of this crisis. Families assume coverage exists. Instead, they encounter a void. Home health aides, dementia supervision, bathing, feeding, mobility support. None of it is covered. The result is predictable. Families spend down assets. Adult children leave the workforce. Retirement savings evaporates, debt accumulates, wealth gaps widen. This is not a glitch. It is the architecture of the system. A national financing mechanism is no longer optional. Aging is universal. The financing of aging should be too. Policymakers now face a narrow window to choose among three viable models: a Medicare long-term care expansion offering a defined HCBS benefits, home and community-based benefit, a new federal long-term care insurance program similar to Social Security disability insurance. A public-private hybrid that stabilizes the failing private LTC insurance market while guaranteeing a basic benefit floor. Each model carries trade-offs: fiscal exposure, administrative complexity, and the need for phased implementation, but all are more sustainable than the current system, which relies on unpaid labor and family insolvency. Recent bipartisan commissions and federal analysis have already mapped out the architectural pathways. What's missing is political will. Paid family caregiving leave, and tax credits, immediate relief with long-term payoff. Caregiving is a workforce issue. When caregivers reduce hours or exit employment entirely, the economy loses productivity, employers lose talent, and caregivers lose lifetime earnings and Social Security credits. Paid family caregiving leave with wage replacement tied to income would stabilize families during acute care transitions. Caregiver tax credits would offset ongoing out-of-pocket costs and prevent families from sliding into debts. These policies are merely compassionate, they are cost effective. Every month a caregiver can remain in the workforce is a month they continue contributing to tax base rather than relying on safety net programs later in life. The direct care workforce, the backbone we keep neglecting. No long-term care reform will succeed without rebuilding the workforce that delivers it. Direct care workers, home health aides, personal care aides, and nursing assistants are among the lowest paid workers in the country, despite performing some of the most essential labor. A national plan must include wage floors tied to regional living costs, standardized training, and certification pathways. Career ladders into nursing and allied health. Federal matching funds for states that expand HCBS capacity. Workforce investment is not a side issue. It is the infrastructure that makes every other work or every other reform possible. Equity must be a design principle, not an afterthought. Black, Latino, rural, and low income families provide more hours of unpaid care, have fewer care options, and experience greater financial strain. Any national plan must include sliding scale benefits. Culturally competent services. Rural access guarantees. Equity matrix tied to federal funding. Without explicit equity provisions, reform will simply replicate the disparities already embedded in the system. A practical implementation roadmap. Policymakers can act now with phased bipartisan strategy. Convene a federal commission to select a financing model and implementation timeline. Pilot a federal HCBS benefit in states with diverse demographics and cost structures. Pair pilots with workforce grants to ensure supply meets demand. Phase in paid leave and caregiver tax credits with income-based replacement rates. Establish federal oversight to monitor equity, quality, and fiscal sustainability. This is not theoretical. It's administratively feasible and fiscally responsible when compared with the long-term cost of inaction. Risk trade-offs and why they are manageable. Expanding coverage raises legitimate fiscal questions. Workforce investment require Workforce investments require sustained appropriations. Shifting program administration between agencies can disrupt services if poorly executed. But the alternative, continuing to rely on unpaid family labor and catastrophic out-of-pocket spending, is far more expensive in the long run. Every year of delay increases Medicaid enrollment, accelerates caregiver burnout, and deepens inequity. The moral and economic case. Caregiving is the invisible scaffolding of the American health system. It keeps older adults out of hospitals, stabilizes families, and supports the broader workforce. Yet we have built a system that extracts from caregivers without protecting them. Policymakers can choose a pragmatic phase package that protects families, strengthens the workforce, and controls long-term costs, but only if they act with urgency and bipartisan resolve. The status quo is not neutral. It's a policy choice, one that is bankrupting families and eroding the nation's economic foundation. Okay, guys. Those are your shows for this afternoon. I will see everybody Monday for shows. Until then, Gator Wellness, have a good day, folks.